Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome Dr. Cara Dionisio, who is a naturopathic doctor here in our community. And our topic that's going to be discussed today is the naturopathic approach to falls prevention. I had the pleasure actually of being involved as a participant, not as a lecturer, in an online education around fall prevention. It was the first time that I'd actually been able to see how naturopathic care can influence those people who are at risk of falls. So I'm particularly interested and delighted to have Cara with us today. So thank you so much for being here.
Thank you for having me.
So I'm wondering, first of all, if you mind introducing yourself to our audience and talking a little bit about being a naturopathic doctor and what studies you had to take to become a naturopathic doctor.
Sure. So I'm Dr. Cara Dionisio, or Cara, or Dr. Cara, however you want to call me. So I'm a naturopathic doctor here in Owen Sound, and I have my clinic is Naturemed Naturopathic Clinic, right downtown. Yeah. And so as a naturopathic doctor, a lot of people aren't quite familiar with what I do, and it was a long path to get here. I did my Bachelor of Science and Master's of Science in Nutrition, which really piqued my interest in the power of nutrition and health promotion and health prevention, and really what nutrition can do to create healthy societies and healthy people. And so that really was the start. And then after my master's, I did the 4-year program of naturopathic medicine, which is in Toronto at the Canadian College of Naturopathic Medicine.
Wow.
Yeah.
So a lot of learning.
Yes, a lot. Yeah, about 10 years. Yeah. But I love it and I miss it. I wish I could go back to school. But as a naturopath, every day is a continual learning process, and so that's what I love about it. Yeah. So today we're going to talk about fall prevention. Yeah.
And how naturopathic medicine can help people. Here in Grey Bruce, would you say we're at higher risk for falls? Like, you know, I know there's a lot of walkers and older people around, but where are we statistic-wise? Do you know?
I don't remember the statistic, but it was it was in the 20 or 30% higher fall risk than the rest of Ontario. I can't remember the exact number, but it was significantly higher in Grey Bruce. Yeah. Not sure if maybe that's our weather or our specific population leans towards more older adults than the rest of Ontario. So that certainly influences fall risk. Yeah. Yeah.
And we certainly want to help people prevent a fall, because we know the consequences when people fall can be very serious.
Right, and it's something, I mean, I hadn't really thought about this before until I was asked to do this webinar. Yeah. And they said, would you like to do a webinar on naturopathic approaches to fall prevention? And I thought, sure, I'm up for the challenge, but not really considering, you know, what that would entail. And then when I dove into the research, I think my webinar had over 100 research papers on it, because there really is a lot that naturopathic medicine can contribute, and that's because we take such a comprehensive approach to health, and so just looking at falls from a lot of different angles really fits well with naturopathic medicine. Yeah. And I think I veered from your question.
No, it's fine. Hey, there's no, it's all good. Okay. So you work as part of a healthcare team, though. Naturopathic medicine is one component of care, right?
Yes, it's one component of care. So we are a regulated health profession in Ontario, which is nice. It keeps the standards high for our education and regulation and safety for the public.
What college then are you regulated under?
It's the College of Naturopaths.
So you have your own college.
Yeah, for sure. Okay. And we are part of, I mean, in our community, we have many fantastic health practitioners. Yeah. I wouldn't say I'm part of a team of care, only not out of my wanting to be part of one, but just because naturopathic medicine really isn't often embraced, to be honest, by the conventional system, which I think is a really big short sight on, you know, just on the general medical system. I think, as I say, we have a lot to offer, and our health system really is frankly failing us. It is great, and we are so lucky to have it for acute care. And if we have an emergency, it's wonderful, but it's falling short in creating and preventing disease and creating healthy people. So we're great at taking care of sickness once it happens, but I think we probably should be focusing on shifting that to addressing health a lot earlier than that.
Well, and when there's only so many resources available and so many dollars that can go into health care, as the baby boomers age, there is a concern there won't be enough to go around. So this is maybe the time that people can start to take care of themselves to their best ability.
For sure, and that's also a good point, is that health is not the healthcare society or the healthcare system's responsibility. It's your responsibility and it's my responsibility. And if we all take that that responsibility on ourselves and really be proactive in living and pursuing health every day and healthy families, that is really what will improve the healthcare system and relieve that burden.
In other words, it probably is a good idea not just to depend on one source of information, not just what a doctor would say or a nurse or a physiotherapist or anyone, that people have to start to do their homework and ask the questions themselves.
Right, yeah.
Right?
If you think something's black and white in medicine, then you're wrong. So I think a little bit of open-mindedness will go a long way. And we're hoping as a result of this program that people, their interest will be piqued even more. I hope so.
And certainly that they would be interested in asking the questions and seeking information.
For sure.
So we're going to pause.
Okay.
And then when we come back, I would really like for you to talk about what you learned when you went through preparing for that webinar.
For sure. Let's do it.
And then as a person, if I was to come for a consultation, what could I expect?
Okay.
All right. You're watching HealthLink. Please join us again shortly. Thank you for joining us here on HealthLink. Today I have as a guest Dr. Kara Dionisio, who is a naturopathic doctor, and we're going to be going into more detail about the naturopathic approach to falls prevention. Thank you so much for being here.
It's my pleasure.
Thanks. Now, so fall prevention and naturopathic medicine.
Yes.
You did a lot of research too.
I did.
Tell me what you've learned from the research.
Okay. So I suppose maybe we should start with why it's an important topic.
Yes.
And as you mentioned, there are a lot of consequences of falls. So I think it's estimated that 20 to 30% of older adults have a fall. And of those, 50% will have another fall, a subsequent fall the following year. So those are quite high numbers, and especially since the consequences are, major injuries. So a fall can cause major, fracture, bruising, lacerations, but it also can take away independence. So a fall can sometimes, unfortunately, have an older person not be able to live in their home anymore. And there are other medical consequences too. So it's a really important topic that I think we might not think too much about. And it's also a topic that really is so broad and has so many factors involved. So there's not only the medical factors, so a lot of risks of different medical conditions and medications that people are on that increase fall risk, but it goes back to even community design, accessibility, home design, mental emotional issues, so like things like depression, social isolation for older adults. You probably can think of other risk factors that are involved. So it's a huge issue, and that's why I think naturopathic medicine has a lot to offer, because a comprehensive you know, an issue that has a lot of factors it's not going to be solved by one
thing,
unilateral thing, right?
Yeah.
And
yeah.
that's actually all of most health conditions.
Yeah.
But
Yeah.
so it's nice to, in my research and kind of in the webinar, what I do is I talk about approaches to a lot of those different factors that
Yeah.
increase the risk of falling.
Take me through those.
Okay.
Educate me.
Okay.
Let me know.
Okay. So where should we start? First, I mean, as a naturopath, nutrition is my foundation,
Yeah.
right? And so when you look at nutritional status, and I mean, we focus more for fall prevention on older adults because that is the higher risk population. But it's also
Older means how old is older?
65 plus.
Okay.
Most of the statistics are for falls of increased risk, and then certainly those risk statistics increase from 80, 85 up,
Right.
even further from that.
Yeah.
And in fact, that's the population that is at highest risk of, we call it nutritional risk, so risk of malnutrition. Because
Malnutrition?
Yeah, malnutrition.
In gray groups?
Yeah, for sure.
Wow.
And
Tell
so
me
that's
more.
a word you might not think of.
No.
And I mean, certainly, yeah, it's a word that sounds stark, but or severe.
Yes.
But really, nutrition is a very challenging and broad topic for older adults because it has those same risk factors. So access to food, affordability of food.
Because they're on pensions.
Right, yeah.
Fixed.
Transportation to where the local grocery store is or farmer's market is.
Right.
Mobility to chop vegetables, eyesight, right? Taste buds, and then medical conditions that change what types of foods you can eat.
Yeah.
So there are a lot of factors that go into diets of older adults, and in general, there's a higher risk of being deficient of certain nutrients, being deficient of protein, being deficient of you know, all of the building blocks necessary to maintain muscle mass.
Yeah.
And so those factors, you know, as nutrition, as a foundational health, important health topic, really play into falls.
And yet, when I think of people who've fallen or just how people are assessed, nutrition isn't top of the list. They talk about poor balance, they talk about muscles, they talk about stiff joints or pain.
Right.
But what you're really saying is we need to dig into the fact that nutritionally they could be compromised, which leads to everything else.
Right. Yeah, nutrition leads to everything.
Yeah.
Because it's what makes up our body, right? And it allows our body to do what it needs to do. So, for example, you mentioned, you know, muscle imbalance. So, sarcopenia is a medical term for low muscle mass. So, in older adults, there's a high risk, or a lot of older adults will have a low muscle mass, low muscle strength, and low muscle speed and power.
So, is that just because we're getting older?
Well, yes, it certainly is part. I wouldn't say it is.
It happens, but doesn't have to be.
Exactly. Yeah.
Gotcha.
It's quite common, and sarcopenia significantly increases fall risk.
Yes.
And there are some really good strategies that we can think about for maintaining muscle mass, because that's the way you need to think about it, is how do I maintain muscle mass as I age, which is a lot easier than getting it back once you've lost that muscle mass.
So you now have both of my ears.
Okay.
Tell me how I can do that.
So there's three, and there's a society, and I have a great paper on evidence-based approaches to preventing sarcopenia. So they have kind of three hallmark keys for doing so. So the first is exercise, which you know, you mentioned, and so their guidelines are 20 to 30 minutes of exercise, both resistance and aerobic, 3 times a week. Yeah. And so
that's not a lot.
That's not unreasonable, not at all. And the 20 or 30 minutes doesn't necessarily have to be all at the same time either.
So it could be in commercial breaks.
Exactly. Yeah. Next commercial break.
PBRs.
Exactly. And maybe you know, there's a lot of community resources, group exercise classes, you know, aquafit, Tai Chi has been actually independently shown to reduce fall risk as a specific exercise. So, you know, maybe work with somebody, a physio or kinesiologist, or one of those group classes to really design a program, schedule it in, and really stick to it over time, make it a habit.
Is there something that I need to take that you would recommend that would help me to build? You've talked about exercise.
So that was their first recommendation. The second one is protein. So inadequate protein, which is the building block of, well, a lot of things in our body, but particularly muscle. So a lack of protein will cause muscle wasting or a low muscle mass. And so ensuring that the diet has enough protein in it is really important. So that can be through diet, through high protein, you know, through meat or high protein vegetable sources, nuts, seeds, things like that. And in particular, there's a specific amino acid that is highlighted for sarcopenia, and it's called leucine. And so that's one of the building blocks of protein. It's an amino acid, and that one in particular seems to help increase muscle mass.
So what you're saying is the changes that people may notice at their age, as they age, don't necessarily have to happen or happen as quickly. There are things that can be done to help.
For sure, there always is. To be proactive and pursue you know, those foundational levels of health, moving and eating well, are probably the best medicine.
As people age and they become more isolated in their communities, or they're not out, and sometimes you hear of a tea and toast syndrome where they just can't be bothered with their protein, or they think, well, that was important when I was growing up. But you're giving a different impression. You're saying it's even more important as they get older.
For sure, and that goes back to some of the nutritional challenges as people age. For example, you can eat foods and you might not absorb them as well. So that would be one issue. So I mean, as a naturopath, another foundation is gut health, right? And so if you're not, you can eat all the good foods you want, but if you're not absorbing those nutrients, then that can be an issue. So I'll work with patients to make sure their gut health is really optimal.
And that's more than just digesting food, right?
Yeah, that, it's digesting food, it's having good bacteria in the gut, having enough stomach acid to break down the food. So one of the topics I talked about on the webinar is I'm not certainly against medications. There's a lot of times where they're necessary, but one of the ones that really can cause a lot of issues are acid blockers. So those are proton pump inhibitors, so things like Prilosec, Losec, Tecta. And what they do is they're prescribed for people who might go into their doctor and say, oh, I've got indigestion, or you know, my stomach's not right, or I eat food and it doesn't sit right, or I get bloated. And that medication is prescribed, but often the statistics show it is overprescribed for things that it shouldn't be prescribed for. So rather than working with someone to change diet and figure out what those gastrointestinal issues or digestive issues are, you take that medication and it blocks your acid, which feels really good, right? So that kind of takes away some of that discomfort. But what then happens with these acid blockers is they block your acid. So obvious enough, but then you need that acid to digest your food.
So short-term relief, but longer-term result.
So Health Canada warns they should be used at the shortest amount of time as possible, but I see people on them long-term. So some of the proven long-term effects are severe hypomagnesia, so low levels of magnesium, which again will cause tight muscles and imbalance. So that could lead to fall risk. It reduces absorption of vitamin B12, which can cause numbness in and paresthesia and the extremities.
The tingling as well.
Yeah. So again, that can lead to fall risk. They can, if you're not getting the nutrients you need, especially if you're taking a proton pump inhibitor, there's increased risk of fracture. And even of infection, because the acid in the stomach is required for fending off infections. So increased rates of C. difficile even, or pneumonia. So
the circle of issues gets bigger and bigger.
I could go on for, and that's where looking at, health as, you can't say, in medicine, what happens is we have all these great specialties, but sometimes the right hand doesn't know what the left is doing. So that kind of overall picture of, you're sitting in front of me, you're not just a kidney and a liver and a knee joint, right? So we have to get back to thinking about health as a whole system, and every moving part affects everything else, right?
And from what you're describing, when people come to see you, that's what you look at, the whole person. That's what we look at,
yeah. So when someone comes to see me, the first visit's an hour and 15 minutes, and we really go through every aspect of their health history and their goals of where they'd like to go. So we will go through medications, supplements, family history, previous medical history, and then all of their health concerns that they're having. We'll go through diet, exercise, sleep, stress, a really comprehensive look. And then what we do is we say, okay, what do we need to do to pursue optimal health, right? And what are your goals for doing that?
So they work with you. They talk about it.
Exactly, yeah.
So what do you say when they say, well, why didn't my doctor tell me this?
Right.
How do you respond to that?
I usually say, medical doctors they're trained extremely specifically and very well in what they do. And that is diagnosis of disease and treatment at that stage, right? And usually in our current medical system, the options are medications or surgery. If you think about what the options are, those are the two things, right? So, the fact, and I would also say, and in defense of, say, a family physician, and we've got wonderful ones, is that they have 5 minutes with a patient, right? And so if I only had 5 minutes with my patients, I couldn't be as comprehensive as what I am, right? And so that really, I'm actually very fortunate that I get to know my patients in that depth and their families, and really work instead of just really work towards optimal health. So
if I wanted to have that time, do I have to get a doctor's referral?
No, you can book an appointment. And it's not part of OHIP, so it's a private health.
Privately paid.
It's privately paid. Most health insurance companies do, though, cover consultation fees with a naturopathic doctor.
Oh, excellent!
Which is really, really great. And so for those who are fortunate enough to have private health benefits through their work, the visits with me usually are covered up to a certain amount per year.
So even if someone was curious to know more, or they just felt they should be doing more for their health, you would encourage them to at least come for the consultation to find out what options might be offered.
I do a free 15-minute meet the doctor visit. And that's good for both of us, actually. So for the patient, they get to meet me, see if they like me, if it's a good fit, and if I'll have, if it's the right healthcare philosophy and approach for them at that particular time. And it's also good for me as well to meet people ahead of time and see if they're a good fit for my practice, right? Because there are certain things that I'll expect as a practitioner that I'm certainly there to motivate and encourage. But if people aren't willing to change their diets and kind of do the work, then that's kind of not a good fit either.
We have a couple of minutes left in the program. Can you tell me what's most impressed you since you've been focusing on fall prevention? Any success stories or anything that has been a key learning for you that you offer to those people who come to see you?
Right. I would say love how it's a comprehensive topic,
Yeah.
which matches well with what I do. And so the underlying root causes are the root causes I look for when I'm addressing any medical condition. So for example, you know, chronic disease is a major issue in our society.
Yes.
And so, and in fact, the more chronic diseases a person has, the higher their fall risk. And so when I look at chronic diseases and fall risk, and I say, okay, you know, arthritis or depression or diabetes or heart disease, you know, all of those will increase fall risk. The medications used to treat those diseases also independently increase fall risk. So antidepressant medications by themselves increase fall risk. So as a naturopathic approach, I don't actually say, okay, we'll give this for depression, this for arthritis, this for, you know, give one medicine for one symptom. What we do is we say, what are the underlying causes to those chronic diseases? And in fact, they all have the same roots. So looking at gut health, looking at inflammation, looking at insulin resistance and blood sugar control.
So it all matches, works together.
It all matches. If we get people, I have a system that I developed with another naturopath.
And you're going to have to come back.
Okay.
Because we're almost
out. Can I tell you what the 4 key areas that people need to think about?
I can.
Nourish, move, relax, and do things you love.
And on that note, we're done. Thanks for joining us here on Health Link. Take care.
Thank you.
That was perfect.
Awesome.